All right. So good afternoon, everybody, and welcome to this WQ, Doctors Wellness Symposium. And happy Raksha Bandhan to everybody. I know, today is the festival day for a lot of us, even for me as well. And it has been a very turbulent day, a lot of traveling and things happening. But still, I could see there are 65 people, who had logged in. But what I could see is that there are a lot of people who have not switched on their videos. So, if I could suggest you, if you could switch on your videos, that will be great, because then, you will be very much attentive, and, you'll be probably able to grasp 100% of what we are actually trying to, portray. So, just to introduce myself, I am Dr. Prashant. By profession, I am a pediatric surgeon practicing in Pune. Post MCH, actually, I had almost, 10 plus years of experience. All right. But, if I frankly, talk about this word called wellness, I actually hardly heard this word, and I was very much well versed with illness. All right, so जो बीमारियां रहती है उसके बारे में बहुत सारी चीजें हमको पता थी, बट कैसे बीमारियों से बचा जाए उसके बारे में बहुत कम इंट्रोडक्शन था हमको. And to be frank, in MBBS actually we had some details in biochemistry about vitamins and some things about prevention. And in PSM, all right, in third year we had a little bit about this thing, prevention. So frankly speaking, I was not aware of it. I was myself overweight, but with the help of this community, I was able to lose 15, 16 kgs. And since then, I have been helping people for different kinds of lifestyle. This is it. All right. So today, what we are going to do is that we are going to portray a case study. All right. So this is a case study which, I have personally worked with, and she is a medical student. All right. So being a medical student, I know we know that, a lot of medical students are, even if you are doing a post graduation, we stay in hostels for the majority portion of our life. And we have an unhealthy lifestyle, we have unpredictable timings, we have lunch happening at 4 o'clock, 5 o'clock. In my case, during MCH we used to have at 6:30, and dinner used to happen at 2:30 at night. So that was the case. So I'll introduce this, a case study of a medical student. And today medical students are also not without stress. So what I'll do is I'll just share my screen and I will tell her story actually, so that it can help you to understand. Just let me share the screen. Alright, sorry. Okay, let me share it. Okay. So I hope my screen is visible. Just let me know whether this, you can see the full screen. Just a minute. Let me just enlarge it. All right. So now it is completely visualized, right? This is a full length.
Yes, Dr. Prashant, we can see it.
All right, just a minute. I think there was some problem. Let me just share it again. Yes. All right. So she's Christina actually, and she's from Nepal, and through one of my friends actually I got connected to her, and overweight has become a very, very common problem. 1 in 3 people actually are overweight. That is the statistics in India. All right. So if you have 4 people in your family, one of them is overweight. All right. And Christina was having a lot of problems related with her overweight problem. She had a lot of lethargy, tiredness, weakness. Even if she worked for a little time, she used to get tired. Weakness was very much evident, in her day-to-day life. Periods were very much irregular, and hair fall was also prominent. All right, and she wanted to get rid of her, obesity, as well as she wanted to lead a healthy lifestyle. But she did not have a right coach, and that is why as every one of us does, we go to Google, we go to YouTube, and we try to take suggestions from other people. And she also did the same thing. All right, and then she tried something called as intermittent fasting. I don't know what kind of intermittent fasting which she followed, but she lost a few kgs. But what happened after that is that she became more weaker and more tired. Her periods became more irregular, and hair fall was more. All right, so these were the side effects actually, the way in which she was doing the weight management program. All right, and through her friend actually she got she got to know about me, and we got connected. And then with the help of this WQ community, all right, and me personally working with her, we started working on her. All right. And this is the transformation which you can see. All right. So this is a, on the left side, you can see that, it's the same pant, by the way. It's the same pant. All right. And you can see what is the waist size. And you can see almost, that is almost 9 to 10 inches loss. All right. Weight loss. It's so amazing. All right. Happiness, which is there, okay, in her mind is just phenomenal. From 96 kgs, she went to 70 kgs in a period of 9 months. All right. So over a period of 9 months, she has lost 26 kgs. And when she got a healthy lifestyle, let me tell you what all things happened along with that. Okay. Day by day, when she was working with me, she always told me that her energy levels are improving by the day. She doesn't feel tired anymore. She can work for a prolonged period of time without getting exhausted at all. Her periods became normal and hair fall reduced significantly. All right, hair fall doesn't stop. Everybody has hair fall, but her hair fall significantly reduced. And what's more important, the self-image is at a different level, the confidence is at a different level. All right, you receive compliments from every relative of yours and every friend of yours. The happiness actually is at the roof. And this thing called as belly fat, all right, this is actually something nobody wants it. All right, no, everybody wants to get rid of it. But the thing is that once you get a right guidance, then you can get rid of it. All right, so this is the way that she worked on her health, and she has got the result. Just to portray before after, you can see now she looks so much fit. All right, and she looks so much fine. So that's the story of Christina. And Christina had been one of the it's like a transformation, is like phenomenal transformation that she had over a period of 9 months. And I just spoke with her yesterday. She is still at 70 kgs, by the way. All right, she has not regained it back. A lot of people, they lose weight but they again regain it back. But Christina has been constant at 70 kgs, and this testimony, all right, was generated many months back, almost 4 to 5 months back. So since last 4 to 5 months, she is still maintaining at 70 kgs. So that's the transformation which happens if you have a healthy weight loss, or maybe a healthy diabetes reversal, or maybe a healthy thyroid. So that's all I wanted to say. All right, and there are other people also who are going to talk about the different aspects of wellness. Okay, so that's all I had to say, Arpan. Thank you very much.
Dr. Prashant, I have a quick question for you before we move on to the next speaker.